So for our bedside swallowing exam, this is our thin liquid, is just water. We have our purees, which is pudding and applesauce. We have our mechanical moist soft, which is canned or jarred pears. And then we also have our regular consistencies, which is crackers and carrots. We have a blue straw and chopsticks to use as our tongue depressors.
Today we're going to do a bedside swallowing evaluation so I can assess the safety of your swallow today.
Okay.
First we're going to start with some water. What I'm going to do is give you a small teaspoon of the water and I'm going to fill your throat while you swallow. Ready? Good. Now say ah for me.
Ah.
Good. Now I'm going to give you a sip of the cup. I'm going to do the same thing. Fill your throat while you swallow. Ready? Now say ah for me.
Ah.
Perfect. I'm going to go ahead and let you take a drink of the cup by yourself while I fill your throat. Awesome. Now say ah.
Ah.
Alright. Next we're going to move on to a straw. I'm going to give the straw to you first and I'm going to feel your throat while you swallow. Ready? Perfect. Now say ah.
Ah.
Awesome. Now I'm going to let you take the straw and take a sip of it for me. Perfect. Now say ah.
Ah.
Alright, now we're going to move on to our applesauce and our pudding. Which one would you prefer today?
Of applesauce, please.
Applesauce? Alright. What I'm going to do is give you just a small bite of this applesauce, and again I'm going to feel your throat while you swallow. Ready? Perfect. Now say ah for me.
Ah.
Take a little peek. Perfect. I'm going to go ahead and have you take a sip of the applesauce yourself. Do the same thing. Awesome. Now say ah.
Ah.
Take a look. Good. Alright, next we're going to move on to our pears here. And I'm just going to give you, like we did before, a little bite of pear. And I'll fill your throat. Ready? Good. Now say ah for me.
Ah.
Take a little peek. Awesome. Now I'm going to have you go ahead and take a bite of the pear yourself and do the same thing. Good. Now say ah for me.
Ah.
Take a little peek. Good. Now we're going to move on to our crackers and our carrots. Which one would you prefer?
I'll have a cracker, please.
Cracker? Alrighty. Again, I'm going to give you a small bite of the cracker and I'm going to feel your throat while you swallow. Well, before you swallow, let me take a look inside at the chew food, okay? Perfect. Now swallow when you're ready. Good. Say ah for me.
Ah.
I'm going to take a quick peek. Perfect. Now I'm going to let you take a bite of the cracker yourself and we'll do the same thing. This time you can just swallow when you're ready. Alright, perfect. Say ah.
Ah.
Take a quick peek. Alright, perfect. So that concludes the swallow evaluation for today. Thank you.